Hi everybody, it's Carolyn Marie with Healing NRG, and guess where I am? Take a lucky guess. Any giveaways? I'm in Egypt, and we just had an amazing tour of the Great Pyramid this morning, so I'm flying a little bit. It was really powerful. One of the things that really struck me while I was here is the amount of conscious physicians that I met. And with my history, you know, that really is near and dear to my heart. So I asked one of them, we have 3 on our trip and more that I've met in the hotel and just on the journeys that we've been through the temples and so forth. But I pulled one special person aside this morning that I'd like you to meet. His name is Dr. John. I'm going to let him tell you what he does. So without further ado, I'd like you to meet Dr. John.
Thank you for having me here today. Yeah, we are in Egypt, and it's a pleasure to be with you. Thank you for wanting me to be interviewed by you, and it's a privilege, I feel. Basically, I'm a medical doctor, and I specialize in treating cancer with non-toxic therapies. Also treat degenerative diseases as well as hormone imbalance, autoimmune diseases with non-toxic therapies.
John, what exactly would a non-toxic therapy look like?
Well, anything that has to do with healing the body naturally, the body and the mind, because our therapies are, we see patients as a whole from the, let's say, head to toe, including the physically, the emotionally, the spiritual aspect of the patient. Non-toxic therapies are therapies that do not use chemicals to heal the disease or the body or the mind.
Wow. Okay, so if someone came to you and they were suffering from colon cancer, what would your first approach be?
First thing that we do is have the patient admitted. We have 3 clinics. The clinics are in different parts of the world to help the patient have access to our therapies. We have a clinic in Israel, one in Switzerland, and one in Mexico, south of 10 minutes from the San Diego, Mexico border.
Is that where your main office is, in San Diego?
I live in San Diego, and we have an office in San Diego and one in Costa Mesa, California. Basically, what we do is we look at the patients to see if they had chemotherapy before, radiation, or any kind of surgery in regards to their cancer, and what level the cancer is in, stage 1, 2, 3, or 4. Unfortunately, most of the cancer patients that we get are stage 4 cancer patients post-chemo, which is a little challenging. It's not the end of the world for them, but it is challenging for us to get the patient back on their feet. So in regards to our therapies, we have therapies that are going to boost the immune system, therapies that are going to allow the pH to become alkaline again, or pH of 7, 8, or 9. Talking about saliva pH and blood pH. Also, the diet is very important.
Right.
We use a variety of types of diets on different types of patients. Regardless of whether the cancer is colon cancer or lung cancer or malignant tumor in the brain, the therapies are pretty much the same. So after we assess the patient, because we have a team of doctors that I work with, and regular physicians like an internal medicine doctor, they get evaluated from an internal medicine doctor. They get a nutritionist, they get a physical therapist, they get sometimes they get a holistic healer depending on what the need is of the patient. And obviously, I evaluate them in regards to their cancer itself. Then we decide what protocol we're going to use on these types of patients.
Okay, that's really amazing. Are these intravenous therapies that you're talking about?
They vary. The therapies could be oral solutions. They could be IV solutions, intravenous solutions. They could be injections. We go from cancer vaccines from the patient's own blood fluids that's processed in the lab. We use hyperthermia. We use sonophotodynamic therapy, poly-MVA, layer trill, and the list goes on and on and on. Also, we do counseling, spiritual work on the patient if the patient allows us to do that. Sometimes we do energy work on the patient as well, if the patient allows us to do that. It is not part of the protocol, but we give the patient that choice if they really want that choice for themselves.
And how does the hormonal balancing come into play?
Well, in regards to what we found out throughout the years is that a patient that has cancer, usually they have hormonal imbalance. It doesn't matter if it's breast cancer or liver cancer, their hormones are not going to be at normal levels, any cancer patient. So we make sure that we check their hormone levels to see where they are and to get them corrected. We do not use blood tests for hormone level because the blood test is inaccurate because it fluctuates from morning to afternoon to evening. So the test that we use is a saliva test that's done for hormone levels, and that gives us an accurate result of the patient's hormone, and then we'll go from there.
And what does go from there look like? How would you say, approach? Because you're holistic, so you're not using synthetic hormones.
Well, I don't call myself a holistic doctor. I call myself I really don't call myself anything. I just basically use integrative therapies. That's basically what our centers are called, integrative cancer therapy centers.
Okay.
We use alternative therapies, integrative therapies, which means we combine a lot of different natural therapies. I guess you could also include holistic in these types of therapies. But in regards to hormones, we use anything from natural remedies. Homeopathy is one of the things that we use the most. We do not use hormone replacement therapies or biological hormones or any of that stuff, because that's really not conducive to the health of the patient.
Yeah, I get that. That's really amazing. And so, you and I have spoken a little. I've been through a bit myself, yet through everything I've been through, I've never heard of you guys. And I actually live in Orange County and was born and raised in San Diego, so I'm in your vortex. Yes, and I'm just wondering why that is, and how can we help people get a hold of you?
Well, basically, I've started this a year and a half ago. The idea of having an integrative cancer therapy centers all over the world. Obviously, when you start something like this, it takes time for people to hear about you and for the actual entity to grow. So basically, the patients that we receive are word of mouth, and the word is spreading. We also I do a lot of conferences where I talk about the options that the cancer patients have and other patients that have diseases. So the word is spreading by word of mouth. We also have a webpage. And
what's that webpage?
The webpage is called www.canceroptions.us. And they're currently working on another webpage here in Europe, that's going to be linked to my webpage, which is www.canceroptions.us. So basically, we try to educate the people on the different choices that they have in regards to their therapies for any disease, not just for cancer, because there are choices. It's not just about taking chemical medications.
Absolutely. Amen to all of that. So in the U.S., you're on the West Coast, and for people, I guess they contact you through your website. It's probably the best place. And then outside of the U.S., in Europe, you're in Switzerland and then in Israel. Yes?
Yeah, outside of the U.S., we're an hour and a half from Geneva, north.
Okay.
So it's close to Lausanne, Switzerland. A beautiful place. If you ever want to travel to Switzerland, that's one of my favorite spots there. We are currently in Israel, in Tel Aviv. They're actually building a huge center in Tel Aviv that's going to be just a great thing for people that are sick, that want to use alternative, integrative, or holistic therapies.
Okay, that sounds amazing, and that's a good start. But I'm also curious if you don't mind sharing with our viewers what brought you here to this magical land of Egypt.
Well, aside from being a physician and specializing in treating cancer patients with alternative therapies, integrative therapies. I also learned and was exposed to energy work as a way of healing different types of physical and mental diseases. And I guess it was a calling for me to come to Egypt and learn more about this type of spiritual journey, which is what I think this is as a personal journey for me, as a spiritual journey to clear my mind and become more in tune to consciousness in regards to spirituality and energy, and just myself being more in tune to these things.
Yeah, well, I'm with you on that one. And now that we're in the final days, or hours, I should say, of this particular tour, what do you have to say about your experience?
Well, I think everybody should, so to speak, if they can in their lifetime, or get out of their box, their comfort zone, and travel, see the world, see what else is out there. Learn from themselves, not just read books and go to conferences from other people. That's good too, but once you yourself go out and seek whatever it is that you want to seek or want to learn about or want to experience, then that's probably one of the best cures of anything in regards to emotional states.
It's one of the things that I've found the most helpful. I call them soul journeys or sacred journeys, and I've been on that quest ever since I started turning things around in 2002. So I agree 100% with what he's saying. And I want to thank Dr. John Jimenez for his time today. As they say in Egypt, shukran, Dr. John. And until next time, this is Carolyn Marie with Dr. John. Have a healthy day.
See you in India.
Yeah.